Guys, welcome to Hustle and Heart. Today, I'm going to do the intro because Liz takes 30 takes to do this, and we're on a time crunch. I got to go get injected. My name is Cizar. I'm an injectable specialist. I do Botox, fillers, PDO, threads, weight loss, and all that great stuff.
My beauty bestie. My beauty bestie, which is great because I've never had a guy best friend. So, and one that Jesse tolerates. So he actually loves you. He loves you a lot. And
I love him too.
Yeah.
He's awesome.
Yeah.
He's awesome.
He's just on it. Did a good job.
Oh yeah, you guys did a podcast on marriage, business,
yeah.
balancing all of that.
Balancing all of that. He got emotional. I was like, record that.
Yes, so good.
Thank you so much for being here.
Thank you for having me.
I can't wait to hear your explanations. All right. Can you share what inspired you to pursue a career as an injector in the beauty and wellness industry?
So what inspired me? Look, since as far back as I can remember, since I was a child, I mean, I don't know if you guys knew, but I'm pretty gay.
Yeah, a little tad.
Just a little.
I couldn't tell.
No, listen. So since I was little, right? Like my family would like laugh. My cousins would make fun of me because I was always the pretty boy. Like I hated going outside to play. I hated sweating. I wanted my clothes a certain way. You know, like
Really?
I still am a pretty boy, right?
Still
Like
are 1,000.
I like it. So I don't know. I don't think anything really like inspired me or like there was like a switch. I think I was just born like really truly loving pretty things,
Okay.
everything. Because I even feel like,
you are that.
thank you. But no, truly, like I just like aesthetic, period. You know, like I like everything that the word means. I like everything to down to my toothbrush. Like I like it to be pretty.
I
So
know this.
yeah, and then as I started studying medicine, I did work in the emergency room. I did emergency medicine for 8 years. I've been practicing 14. 10 of those pretty much was emergency medicine. Then the last 4, I decided to transition completely. And I was like, I'm going into aesthetics. I was doing it, kind of dabbling in it a little bit while I was in the ER. And for those of you listening who are watching, who want to go into aesthetics, this is just a little side note.
Okay.
Please, aesthetics is not a side job. This is a very hard craft. We take it very serious. It bothers me when I hear other medical professionals say, oh, I'm going to do Botox on the side. No, we don't do this on the side. This is hard work. It's a craft that you have to perfect. It's a lot of facial anatomy. And as the field evolves, you learn. So I made that mistake. I was in the ER and I was like, oh, I'm going to do Botox like on the side. I quickly figured out, I was like, this is not a side thing. This is a real full-time thing. And I fell in love with it. And I left emergency medicine and I was like, yeah, this is definitely me.
You have definitely perfected your craft.
Thank
It's
you.
so good.
Thank
And that's a good point because people need to follow up with CEUs. They have to invest a lot of time in learning, keeping up with the trade, going to different, marketing events or the training events and the vendor events. And there's always a new medicine coming out. So that is true.
Yeah, like everything in
Invest a lot of time.
medicine. Yeah, I always say like this is medicine.
Right.
You know, there are some people that will knock it, other medical professionals and say it's not, but it is. I mean, we're dealing with faces or other parts of the body. We're dealing with real anatomy and physiology, and you have to know that. You have to know it. You have to really, really respect it. And like everything in medicine, it's always learning, it's growing, it's constantly evolving. You have to stay on top of it. You're never done. I mean, I'm not done.
Yes.
I literally, if you give me 5 trainings a month, I'll do them all.
You love
I'll figure out the time.
Forever student.
Forever. And you have to be, especially in aesthetics.
I love that about you. That's awesome. On another note, what are some of the latest trends in beauty and wellness that you're excited about? Something you want to share with the world?
So there's so many. Every day something new is coming out. I mean, lately the buzz is like the salmon sperm.
I heard about that in the Kardashians. I was like, what?
Of course, they're so beautiful.
They are. I'm
so I haven't really studied it, to be 100% honest. I haven't
was a thing.
sat down and like read about it 100%.
It's a real thing? It's salmon's sperm.
I think.
Okay.
I think.
Not
Like I
whale.
said, I don't want to give wrong information or false information. I think it is.
Okay.
I mean, it seems like it is
They
from
said
like
whale.
the little bit that I've seen. I'm going to study and I'm going to
Okay.
get back to you on that. But
Get back
that
to
I'm
me.
very excited about that. Whatever that is, I've heard good things about it.
If Kim K is doing it,
Yeah.
we gotta do it.
Yeah, then we got to do it. She's like, she's
life.
forever young, literally.
Okay. Okay, so that's interesting. Keep us posted. When a client comes in for the first time, how do you assess their needs to create a personalized treatment plan for what they're looking for? What do you do?
So that's like the most important part, right? So everything's important, of course, down to the injections. But to me, the consultation really truly is number one, two, and three. Like I have all the girls in the office, they know, like that's when you really sit down with a client and I have to get a little uncomfortable and ask them, an uncomfortable question. Why are you here? And if you really listen to that question in the world of aesthetics, no one is there because they're perfect, right? You go there because you want to enhance or you're chasing a different look or
Some
something else.
insecurity.
Exactly.
Yeah.
So I have to talk that, have to talk about that and point that out. They pointed out to me, I don't like my nose or I don't like my lips. I feel my cheeks are flat or I have too many wrinkles or my skin doesn't glow. So there is when really like I have to connect, and come up with a treatment plan and tell patients, what it is that we're going to do. But
Yeah.
that for sure is the most like crucial part of the entire experience.
Sometimes you even have to turn them down and say, no, you can't get 3 mLs on your lips.
Yeah, oh
Cannot look
Jesus.
like a Brad Star.
Yeah.
But
Yeah. No, I
okay.
mean, a huge part about this industry, and like anything in life, right? Everything you have to do in moderation. So, as a great injector, right, that we all want to be, you have to know when to say no. You
Correct.
can't look at everybody as a dollar sign.
No.
This is a business, it's reality, right? We got to keep our lights on. But the truth of the matter is that a great injector knows when to say enough is enough.
I get that feedback when I refer clients to you, and they come back saying they come back kind of like upset but grateful that they're like, he turned me away, or he said I couldn't do this, or I had to do this before that. And they actually take a moment and say thank you. Like a few days after you
Yeah.
turn them down, they're like, what, thank you, I appreciate that. It's just not a money pit for him. He's not just, it's not a factory, and they felt, cared for, valued, and heard most of all.
That makes me so
So
happy.
I would say like 9 out of 10 out of my friends that have gone to you, that's the one thing that they say. He listens, he assesses, and he lets me know what I should and should not do.
Yeah,
And like
yeah.
I said,
So,
they've been pissed.
yeah, no, I mean, I get it. And transparency,
Yeah.
like at the end of the day, too, like my main priority and my main focus is my client, making them happy and look how they want to look or achieve the goal that they're there for, right? But also on the back end, my name is on your face, right? I don't want you to walk the street and someone asks you, "Hey Liz, who did your lips?" And
Mm.
deep down inside, they're not asking because they want to come to me, they're asking because they want to run away from me,
Oh,
right? So it goes like it's the same token, if you would,
right.
right? You have to be careful. You got to do great work. You want to achieve the goal, but at the same time, protect your reputation. Yeah. So, and yeah, going back to what you were saying, clients, I turn a lot of people away,
Right.
turn away in the sense of like, I'm here for cheeks. And I'm like, no, you don't need cheeks. Like maybe let's slim out your masseters instead. Right. And that's going to help your cheeks look bigger. Oh, I want these lips. Lips. Let's talk lips because everyone wants
Yeah.
lips.
Let's do lips.
Um, my big thing now, I'm very prideful and I say I don't gatekeep. I talk about it. I have been doing this for a little while, 4 years now, and I've discovered a little thing where I like to do lip flips. Yeah.
Yeah.
Before I actually fill the lips,
Okay.
right? So it relaxes the orbicularis oris muscle, which is a muscle around the mouth. And then I feel that when I'm filling the lips, well, first it gives a nice, more natural pink show of the lip. And then when I'm filling it, it's so much more easier to lift that cupid's bow. I've noticed.
Yeah,
And this
it's
comes with
true. It's
practice.
true. I just saw my smile the other day because you just did that on me
Yeah.
a few weeks back. And I'm like, oh, now you can actually see my teeth. And I
Yes.
see like a little bit,
Yes.
my lip like come out a little bit
Yeah.
more.
So
Yeah.
going back, circling back to what you were saying, sometimes clients come in with this unrealistic expectation where they're like, I want my lips, and they think they're going to walk away in one sitting with these huge Kylie Jenner, gorgeous, full, luscious lips. And I'm like,
Yeah.
maybe, but maybe it's going to take like 6 months because we're going to have to do multiple syringes over multiple sittings, and multiple
The appropriate
approaches.
way.
Yeah, the right way.
Yeah.
So that is where the transparency, the communication, and all of that comes in.
Correct. Okay. I like that. Amazing. Like I said, everybody raves about you and
Thank
how
you.
you do that. What are the most important safety protocols to follow when you're performing those injectables, those fillers?
Okay, so it's funny you bring up safety because I'm
Oof,
obsessed with that.
you are.
A little too obsessed. So, like everything, right? Any
Okay.
kind of procedure that you're going to do. I mean, I always say this life is a risk. Like waking up and breathing is a risk, right? You get in the car, you're going to work, you put on your seatbelt, you do everything correct. You can get trampled by another car,
Oh boy.
it's just real life. When you're injecting, same thing, right? You're doing fillers, vascular occlusions with filler hyaluronic acids. That's like the main thing that you worry about as an injector, you want to avoid. So, safety number one, you got to know your anatomy. You have to know it. You have to know it like the back of your hand. You got to study and you have to know where those veins, those arteries, those nerves, where those bones sit, those fat pads, muscles. You need to know it. There's no cutting corners with that. Once you do know it, you better respect it as an injector. Like, respect it. There are high risk areas that you can go. There are areas where you should not go and you cannot go. And for me, like, safety is
Yeah.
number one. I respect
Most
anatomy. I
important
know
part is
it.
the anatomy, knowing
Yeah.
that inside and out.
Yeah, yeah,
Right.
yeah. You got
Yeah.
to know your
Agree.
anatomy. And then after you know it, you better respect it. Yeah,
Correct.
respect it.
Okay.
Because if you don't, well, then you did that to yourself.
What would you say is your favorite injectable treatment that you recommend to clients? What's your
Oh,
top
it's not
two,
lips.
three? No, I would have
No.
thought it was lips.
Yeah,
I
yeah,
know you
yeah.
love doing
Yeah, yeah,
lips.
yeah. Thank you. You go to my Instagram and you see a lot of lips and I feel like that's what everybody wants. Everyone just
You're
wants
known as
lips.
the
But actually
lip god.
my favorite filler procedure
Any procedure. What's your favorite
right now,
right now out in the market?
Sculptra.
Ah,
I'm
okay. Haven't
all
been in
for
for
a
that yet.
good Sculptra.
Okay.
So, okay, so we're moving into, by the way, for those of you who don't know, I'm Colombian or my family's Colombian. So we're like the capital of like plastic surgery and all that good stuff, right? So, there was a time when the look was like fake.
Right.
That was it. That was the look, big breasts, big hips, big buttocks. Now it's all about like being natural, like the effortless chic, right? Like, oh, I'm gonna go to the grocery store and wear like a Balenciaga hat and sweatpants. But I thought about this outfit for a whole week, but I look like I didn't try. So in the world of aesthetics, we're moving toward that, right? People want to look like they didn't have any work done and they just woke up. I woke up like that, like this.
Mhm.
So yeah,
Minimalist?
yeah,
Yeah.
so Sculptra, it's not a hyaluronic acid, it's
Okay.
not a filler
What is
per
it?
se. It's a poly-L-lactic acid. So you inject it, it's almost like water based, and think of it like a fertilizer for grass,
Okay.
but it's collagen. It's
Okay.
all
Oh,
collagen.
does it help
So
you
you're
produce
laying,
collagen?
yes,
Okay.
yeah, it causes neocollagenesis, which is a
New.
25-cent word for more collagen being born.
Correct.
So we're seeing younger people coming in for it, and even my older clientele, right? That's what makes us look young, collagen. Filler does, restructure, remodel. It also produces collagen to a certain degree. But right now, my favorite, Sculptra. I'm
Yeah.
all for a good natural, but
I
like,
can't wait to do that.
yeah.
I know
Let's
you've
so you
actually
get to it like
you've turned me
everywhere
away already. So
for a little while. Yeah, she
okay.
went, by the way, Liz went to filler jail. I have a thing called filler jail, which is I'm like, you're in jail for a year. Sorry.
Okay. What advice do you have for someone considering injectables for the first time? And how can they prepare and what should they expect? Cry. Just kidding. That's what I
No,
do.
okay, okay, okay. Yeah, yeah. So, all
Go.
right. So, Liz loves getting work, right? You love it, obsessed with it.
Yeah.
Probably one of my worst. Probably, I have to say, your top three, like, moves around, cries. I'm like, you're numb. I
You
know you
know,
don't
now that I
feel
think about it,
this.
I think I do this everywhere in anything. It's
Yeah,
just, I'm so expressive and emotional and like,
yeah.
yeah.
But, wait, I forgot. Cut. I forgot the question.
No, you know what I was gonna say because I wanted to know why was she in figure jail? Oh, I was gonna ask that because he hates how I act like I start
Oh,
crying
yeah,
or
yeah, yeah.
what? Why was it? Or because you no more or was no more or because I cry?
Okay, guys, so we just came back from a quick break and everyone's like, "What's filler jail and why was Liz in it?" Let's go back to that. Let's go
All
back to
right, let's
filler
do
jail.
that.
So filler jail is basically that. You go to jail, you cannot get filler. A lot of women or
Hmm.
men, anybody comes in and they start abusing a specific
Yeah.
procedure.
Okay.
Lips is like the main one.
Hmm.
Lips get full, you're swollen when you get them done. You sit up in the chair, you're like, I love this, I want it, I'm keeping it,
Yeah.
this is it. Then time starts to go by and you see your lips and you love them and you get used to the look. And then you're back in my chair like 3 months later and you're like, my lips went down.
Yeah.
And I'm like, yeah, no, they totally did not go down.
Yeah.
It's just you got used to seeing them full
Right.
now. So then, yeah, for those of you wondering, Liz was like, I think I need more. I think I need more. And I was like, nope, nope,
I
nope, nope.
know.
It's just because you get used to it. You get
Yeah.
used to it. And
I
you
love
start chasing
it.
that. You chase the feeling of when you sit up in the chair after the procedure and you see the
Sort of like a
transformation.
high. Like, wow.
Yeah. So
Transformation.
that's what everyone wants. They want to see the
Yeah.
transformation. And I'm just like,
Yeah.
you got used to it. It's still there. You just got used to it.
Okay. Well, speaking of filler jail, how can you stay out of filler jail?
So that's a great question. Don't abuse procedures. No, definitely keep your appointments, but let's do like a plan. This is what I do with all of my clients,
Treatment
right?
plan.
Yes, treatment plans. Like the consultation is super important, so is a treatment plan. So like come and do your talks, every 4 months. I think that's pretty safe and average to say across the board. Do your Botox, your your neuromodulators once every 4 months. Your lips, let's say, if you have lip filler, maybe touch them up once a year, I think is sufficiently enough, right? Every time that you come in for your 4 month eval, just, ask your injector, ask me, how do I look? What do you think? This is what's bothering me. Does it still look good? Do we need to retouch it? Like just kind of stay on top of your procedures, but don't necessarily get them done over and over and over again because sometimes you just don't need to.
Right.
And for sure, Morpheus is great. A lot of collagen production there. Your
Okay.
Sculptra once a year, a lot of for you.
Yeah.
Everybody's different. Sculptra once a year, great for collagen production. Sunscreen.
That's your biggest thing, you know?
Yeah.
Yeah.
Yeah,
Okay.
yeah. Like sunscreen is number one. I've
Yeah.
said number one like a million. Everything's number one.
That's like my favorite food. I
Yeah.
love this food. I love this drink. It's
Yeah,
my
no,
favorite
but
drink.
sunscreen, I mean, take care of yourself, right?
Yeah.
You take care of your skin, you take care of like the texture of your skin. Just the texture alone like takes off so many
Right.
years. So yeah, how to stay out of filler jail. Healthy skin routine. Wash your face, use your toner, use your sunblock, use, your vitamin C, yada, 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 all that good stuff. And then in terms of like injectables, do your talks every 4 months and then check in with your
It's good that you're
injector.
saying the fact about the 4 months because I think people think that Botox lasts forever or for like a year, and they
Yeah,
need to
no.
learn the difference. Or I'll hear, or they'll text me, "Hey, I see lines again," and I look back, yeah, because it happened like 5 months
Yeah.
ago. So you have to do another touch up. Oh, really? And they don't know, or they went somewhere else, and they come in complaining like, "Look, it didn't last." And we want to be fair to other injectors and let them know, "Hey,
Yeah.
guys, like it lasts, 3 to 4 months.
Yeah.
If you're
So
lucky, 6, right?
yeah, I've
No?
really never
Stretching
seen
it?
6. Yeah,
Okay.
I've seen like stretching it, maybe getting close to 5,
Okay.
right? Or hitting that 5 month mark, but 6, I've never personally seen. There is a new product on the market now, Daxify, which does last longer. It's pricey, but I mean, it lasts longer, right?
How is it
So,
compared to Botox?
I mean, I like it. I think it's great. They all work good.
I want to try
There's yeah.
it. I want
Let's
to
do
try
it. Let's
really.
try it. I like trying new things too. Um, I recommend it. I mean,
Okay.
it all depends. Like if you're you, I think you would be great because you hate needles. You
Right.
hate pain.
Hate the
Oh, this is
pain.
perfect. We
Yes.
should do Daxify on you.
Just do it
Yeah, it
next
lasts
week.
longer.
Okay.
It lasts. They all work. They all
Sold.
work. They all work great. You have to know what you're doing and how to inject it.
Right.
But for you specifically, I think like the biggest advantage is that you don't have to inject so often, right?
Okay.
But yeah, let's talk about how Botox does not last like an eternity.
Yeah.
Great. I tell my clients the good news about aesthetics, it's not permanent.
Yeah.
The bad news about aesthetics, it's not
It's never
permanent.
minute. Okay.
Right. So yeah,
What's
I
more
mean,
on
it all
there?
like is the glass half full? Is it half empty? It's all how you look at it,
How long
right?
does filler last?
Filler, depending on the G prime and the type of filler that you're using, but the average on fillers is going to be, I'd say, 8 to 12 months.
What are some things that can cause Botox or fillers to dissipate a little bit earlier? Is it things that we do?
Me, I'm a perfect example. I cycle like crazy.
Yes.
I love indoor cycling. I mean, I'm
I I wanted to just let my viewers know that because that's another thing. I'm like, okay, are you exercising 24/7? Are you in the sun 24/7?
Yeah,
What are your
so
daily habits?
your metabolism, just in general, I mean, that can metabolize a product faster, period. If you have a fast metabolism, things that we do that can metabolize a product, exercise, for example, unfortunately, you do it to look good, feel good, be healthy. But the bad side of that is that it will metabolize your product faster.
Right.
Um, Quick tip I always tell all of my clients, zinc daily has been shown, clinically studied, to help you hold on to your toxin longer.
Interesting.
Yeah.
Dr. Ray was just doing a podcast on zinc.
And
Yeah.
zinc, yeah,
Uh-huh.
has like all
Okay.
these like health benefits as
Right.
well, right? So for your immune system, et cetera, et cetera. So
Okay.
all that. But who needs an immune system? We need Botox. Like, yeah, take your zinc for your
Real talk.
Botox.
Real
Forget
talk.
about, yeah,
Yeah.
forget about your immune
Yeah.
system. Yeah. So that's a good tip. Other
Okay.
than that, taking care of it, right? Doing your face routines. I mean, that's not maybe going to influence too much. Sleep facing up.
SPF.
Yeah, SPF, I mean, your day to day, but other than that, then like the actual like exercising, I don't really think there's something that I
A
could
much more
say,
stronger
well,
component or
right, right, that'll
okay.
like metabolize it and your metabolic system.
Okay. Perfect. Perfect.
What do we say here? What do the YouTubers say? Click, subscribe, yeah, share, do all of that.